Welcome back. The program is still Good Morning Abuja, and of course, we'll be delving into the medical world now, where we're talking about excellent medical services. As we know, health, they say, is wealth, and for one to be able to enjoy wealth, one has to be healthy. And this morning, we are examining along the value chain of what constitutes qualitative healthcare service delivery. We're examining digital records, keeping digital records. In the advanced countries, it's this debate is ongoing. Already, you get to the hospital and within seconds, minutes, you are able to see a doctor, get diagnosed, and get treatment. But here we see our halls or waiting halls with people packed few, people sick and struggling to be able to get to the doctors. The reason is because the doctors do too much. The moment they get to the hospital, they begin to diagnose, to have to do all those checks to be able to determine what the ailment is. Now, imagine that we could have a system where, as a patient comes, he already is passed through those checks, a digital file open in front of the doctor on the computer service something, and he just knows that okay, oh, this person is suffering from this, and this could be this is possibly areas that he has received treatment, and this is how we could further his treatment. That would truly make the wait time less, much smaller, and of course, ensure that people do not feel too stressed to go to the hospital. This conversation is what I'll be having with our guest this morning. And of course, I'm talking about not other person, but somebody who has developed a solution, one that we should be proud of. I'm talking about Mr. Kunle Adeshida, the co-founder, Chromium, Cranium Health Service, Health Integrated Solutions Limited. You see, the name itself sounds this thing is cranium, like the brain. And of course, joining us also in the studio this morning, Mr. Zayad Aminu Yahaya, who is also a board member of Cranium Integrated Advisory Board, Integrated Services Limited. You're both welcome to Good Morning Abuja.
Thank you so much. Thank you.
Yes, sir. So we're talking about medical records keeping and how vital it is to the medical field, especially in assessing medical care from our hospitals. Now, let us have an overview of what this problem is. Dr. Kulena, how would you analyze what we have presently? Is it that bad?
Oh, well, basically, the foundation of healthcare is data. And when data is not readily accessible, there is virtually little or nothing that the healthcare practitioners can do to help the patients. Over time, we have seen a lot in our healthcare facilities across Nigeria, even beyond, because I don't want to make it look like Nigeria is doing too bad compared to other African countries, even beyond Africa. Basically, the angle we need to begin to look at from now, at least, everybody's eyes are now opening up to how things can be better achieved in our healthcare facilities. We should look at the area whereby data can be easily accessible. Because what we have currently now, if we want to compare that, is a lot of build-up of waiting time, which does not allow patients get adequate healthcare as at when needed. You go to the hospital as early as 7, 8, and at the end of the day, you are getting home around 2, 3, just to see a doctor for a diagnosis. How long will it take? If it's an intensive care that you will need eventually, there's already a build-up of waiting time, which will eventually worsen the diagnosis the patient actually went to the hospital for. So once we're able to clear up that area, healthcare delivery system in Nigeria is going to take a very good turnaround.
Okay. Now, Dr. Zaya, you understand, you followed up on what Mr. Kunle just said.
Yeah.
Now, how difficult would it be to transition from the analog system to the digital system so that this data can be readily available for doctors?
Um, I wouldn't say it would be that difficult because we've gone quite far as a country. Um, Even in the ICT sector, you can recall in the early 2000s, computers were just in few homes, few offices. Was as at now, uh, you can see people even in the rural areas going on TikTok, doing dance challenges and whatnot. So we've gone far, and Africa has actually leapfrogged that stages of industrialization. We went from analog to digital. We didn't go from analog to, having intermediate industries.
Yes.
So we leapfrog. If you go to Kenya, for example, Kenya, I think at a point in 2016 became one of the best countries financial services
Yeah.
using Safaricom. You could just have a number, and then I can use the number to transfer money to you, which was not done anywhere else in the world.
Wow.
Yeah, so we've gone really far.
Wow.
So the transitioning is not something new. We're used to it, and I believe with these kind of solutions, would carry on with the health sector as well.
Okay. Now let's still come back to you, Mr. Kundi. Now, when we talk about digitalizing, and if we take your very brilliant explanation where you said it's going to cut off wait time, it's going to stop further degeneration of whatever the symptoms are or whatever the disease is, and all of that. Is this something that could be applied not just only within our urban centers, but also in our rural areas?
Okay, so when you mentioned digital tools have gone beyond uh, subjecting it to a particular area.
Okay.
In our urban areas and rural areas where we have lower technically inclined people, we have tools that they can use that will easily let them have access to healthcare, as the case may be. What we've done in that area is we've made data easily accessible via QR code, where patients can easily have access to their data. This is a card. This card is called Cranium Biometric Health Card.
Wow.
It has a QR code behind it.
Can we take a look?
Yes. So that QR code behind it grants you access to your health history from anywhere in the world. Now, you talked about urban and rural areas. Now, it is from anywhere in the world. Even if you are outside the country, in the US, anywhere, you want to access healthcare, all you need to do is have a smartphone, scan the QR code, and then it takes you to a landing page where you enter your unique identity, and then it gives you your history viewable. Now, for any healthcare practitioner or provider that wants to continue care on you or treat you, can easily see your previous histories, your medication history, your diagnosis history, what have you. They can see all of that, and that can guide them in how they can apply healthcare. And now this card does not only work for healthcare, it also is also integrated with financial institutions, whereby you can use it to withdraw, do payments, do transactions across board. How will this now enhance healthcare? You go to a facility, all they need to do is they scan the card, your history is accessible. For hospitals who are already onboarded on our application, they can just continue care on you right there. And then our system also helps the clinicians. We have a clinical decision support system embedded in it that guides clinicians across board as they attend to the patients, which has all normal values and abnormal values of healthcare readings across all patient contact points. So you see, we have simplified these things such that even when a clinician is attending to you, there is an AI sitting on the application that is guiding him or her on the flow process, which makes the work seamless and easy, and it will eradicate waiting time totally and make your data readily accessible.
Amazing. As you were speaking and I took this card, I thought it was your ATM card. And then
It's beyond that.
I am seeing you explaining something. You're talking about the QR code, which I'm seeing here.
Yeah.
Yes, I'm seeing the bank is this card is linked to a bank.
Yeah, this particular one is linked to Wema Bank. We're already integrating with Fidelity, Zenith. We want to have as many banks as possible on the platform. So your cards can be domiciled in any bank, and then it is well secured. The financial data is sitting on the banking servers, and the health data is sitting on our own health data centers. We have data centers across Nigeria, even outside the country. And these data centers are well secured because we have to ensure that history and data of patients, both the medical and the financial part, is well secured.
I'm going to go back to that security of this data because now we're talking about medical history being kept in the database. But before we do that, let's quickly go on this short break. When we come back, I'm sure there's still a lot that we could learn, but already I'm excited. This is interesting. So stay with us. Welcome back. The program is still Good Morning Abuja. And before we went on that short break, I had the opportunity of seeing a card that Mr. Kunle was carrying where he talked about it looks like an ATM card. To me, it's an ATM card. And yet, it has so many features. It has your money in it. It has your medical history in it. So whatever happens, you could, if you find yourself in a place where, God forbid, but you happen to need help, it's easy for the doctors to be able to reach you via this card and understand what your previous conditions are and provide you care. This is a beautiful innovation. In this is this not a technology that could probably put us far ahead of Kenya now when we talk about medical ability to access medical care?
We're already ahead of Kenya in terms of mobile penetration.
Wonderful.
Yeah, so we're already ahead of them. But then, as he said, I think this is not only going to be a bragging right, but it's going to help those people in the rural areas to access healthcare faster and more qualitatively. Yeah, and then it will streamline all the processes of, as you said, waiting time, and then the government will be able to have access to, health records of patients, NGOs and whatnot can key into all these things and then more easily. So, as you said, the data is going to be more accessible.
That is very, very good because I am beginning to see the possibilities that this could unleash. Talking about policy formulation, talking about having accurate data to be able to put a lot of things in place. This is really beautiful. Now, Dr. Kunle, Mr. Kunle, sorry, I'm already calling you a doctor because it looks like you're
a doctor.
Oh, you're a doctor.
I'm not a doctor.
Oh, you're not a doctor. Oh, sorry, I'm getting it all mixed up. Well, Dr. Kunle.
Yeah.
Now, when we talk about this solution that your company has been able to bring forth,
Okay.
I have some gray areas. One of them is how accessible is this technology? One, to the hospitals, two, to the patients.
Okay, so I need to quickly drop this, that this technology is an home-built technology. We have the patent rights, so the solution belongs to us. And so we've made it easily accessible. It's not too expensive, and it is available to as many healthcare facilities and individuals that really want to get their health data digitalized and easily accessible from anywhere they are in the world. Apart from them having to receive care in the hospital, you want to do something anywhere, probably in the embassy or anywhere, they need your health history. You don't need to begin to go back to your hospital to request for, you need this report, you need that report, you can easily with your phone scan this, log in, and then download any report you want real time. In seconds, it will respond to you. Now, the area that we need to begin to look at from the area of healthcare facilities is where we can begin to equip our facilities internally, which the government has already started. There is a digital transformation project that is starting very soon in the Ministry of Health. We, by the grace of God, we happen to be one of the companies that is likely to pioneer this. By the time this is achieved, the pilot stage is going to cover a lot of hospitals in Nigeria where patients can just walk into any hospital, not because you are using that hospital before, but condition has made you land in that hospital. Your history is going to be accessible right there because from what we have gathered, we already have a forum. Every healthcare facility now, company that develops EHR or EMR, they're going to have an interoperability system such that data from solution A is going to be accessible by solution B. So now, for developers who have deployed in different hospitals, data is going to be streamlined such that they can interconnect from the back end, and then your health history in Loot can then be accessible directly from Abuja without you being needing to run helter skelter, because that is one of the things that is going to reduce mortality rates. Incidents happen and then people are rushed to the hospital, nobody has their information. But with the system we have on ground, even if it's their thumbprint that you can place on the reader, it will give you all their history, give you their name, give you their next of kin, people you can contact, even when the patient is unconscious.
Amazing. Now, there's still a lot more we have to talk about on the program. So let me ask this very important question now.
Okay.
We already have something like the National Health Insurance Service, and we have so many other health programs that the government is putting forth. Now, with this solution, is this something that's going to cover all hospitals, whether private, public, primary health centers, and all?
Yeah, the project the government is actually heading to, I believe in about 2-3 weeks from now, the project is going to be started.
Okay.
So a committee has already been set up by the president monitoring the project, and I believe this particular one is going to work. We have seen the trend, and it's going to cover all facilities from tertiary to private to secondary, and it's going to cover primary healthcare centers too. They are not left out, such that when you even go to a small PHC behind your house in the local and rural areas, you are going to get quality care as you will get if you are in the city and you walk into any modern hospital. That is what government is trying to achieve now, and is in top gear, and I believe we're going to achieve it.
So our conversation this morning has been on digitizing medical records for easy access, treatment, diagnosis, and all that any patient would get from the hospitals. You know, the world we live in now is a fast-paced world. Things we can do with our phones, and that's when solutions like this meet technology, we know that yes, we are not being left behind. Instead, we are trailblazing for those that will come after us. That's why this morning I'd like to thank our guest, Dr. Kunle Adesida, the co-founder and CEO of Cranium Integrated Solutions Limited. Thank you for coming, sir.
Thank you so much.
Yes, I also like to thank Mr. Zayad Aminu Yahaya, the member advisory board of Premium Integrated Services Technologies Limited. Thank you for coming.
Thank you.
So, if you do come across this technology or you do come across this company, please make an effort to get your records digitized. It could save you, and of course, you know, we live in a digital world. One card is an ATM card, is a financial card, is a medical card, is everything. Who wants to take that? I will want to have this. So, but the program is still good for you. Stay with us when we come back. There's still more on the show.